Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Thank you so much for joining today. And I welcome you all to another exciting webinar from our monthly webinar series. Today, it's actually a very special one because we have very special guests who are very respected and very accomplished in their profession who will actually talk about the compliance needs in the world of cosmetics, supplements, and any health products that you might have there. And with that, I'll actually introduce our first guest, Andrew Prashad, who is the president, CEO, and founder of Quality Smart Solutions and Quality Import Solutions, which is a leading North American provider of regulatory and quality assurance services. His companies have helped brands and manufacturers meet FDA and Health Canada, specifically for Canada, requirements across sectors, including, like I mentioned, dietary supplements, food, cosmetics, ingredients, OTC drugs as well as medical devices. And with a background in science and compliance, he's actually founded Quality Smart Solutions in 2007, supporting more than 3,500 clients worldwide till date. He also later launched Quality Import Solutions, a Health Canada licensed importer of record for foods and natural health products. And I'm sure he'll actually do more justice to his introduction later on when I pass it over to him. But thank you, Andrew, for joining us. I welcome you. Um, and with Andrew, we have another very special guest, Kari Scotia, who's our senior regulatory solution specialist. She is a dedicated and highly knowledgeable natural health products and site licensing expert with an extensive background in human health and nutritional sciences. For over 20 years, she has demonstrated team leadership and success in ensuring product compliance with Health Canada's natural health products and nutrition labeling regulations, a very demanding area in Canada and something that you all should be looking forward to learn about. And just to actually mention, she's a highly skilled professional in conducting scientific research and interpreting studies to support product safety, quality, and efficacy. So, Kari, thank you so much for joining us. And I'm very excited that we have you both here and very excited for all the expertise and wealth of knowledge that you will share with us and pass it on to the audience as well. So without further ado, I'll pass it on to Andrew to take it over.
All right. Thanks very much, Zohaib. All right. So we're going to jump into our discussion today, plans to expand to Canada and looking at the compliance pathways for dietary supplements or natural health products, as they're called in Canada. We're going to talk about cosmetics and foods. All right, next slide.
Sorry, can you see the entire screen or not?
No, we're seeing.
Okay, just a second then.
Okay, yes, we can see it now, the full screen.
Okay.
All right, perfect. So just a little bit about us, as Zohaib had summarized. We were established in 2007. We've helped clients worldwide over our 18 years now, covering Health Canada, FDA, and other markets as well. And I've been doing this since 2007, but also prior to that, I've been in research. I've published a few studies when I was at McMahon. So I have quite a bit of experience, everything from the science and clinical research side through to regulatory compliance. All right, and I'll pass it on to Katie, who'll be talking about natural health products and the regulatory landscape.
Yes, natural health products. Natural health products, my favorite thing. So these regulations came into effect in 2004, so it's been over 20 years now. But it's still a work in progress on both Health Canada's side as well. So what are natural health products? Natural health products are defined as naturally occurring substances that can be used to maintain or restore health. Health Canada regulates NHPs to ensure that the products are safe, effective, and of high quality. And even though they're generally considered lower risk, they are not without risks. So they can be vitamins, minerals, probiotics, sunscreens, toothpaste, homeopathics, traditional medicines, amino acids, fatty acids. And NHPs can be in variable dosage forms like tablets, capsules, powders, liquids, gels, and gummies. And they should not be in a food format like you can in a bread, for example. They can be administered through multiple routes as well: oral, nasal, otic, or topical. So there's several requirements to sell your NHPs in Canada. So first, you need to apply and obtain a natural health product number, NPN number, that have to be in every product. You need to obtain that number before you start selling in Canada. The labeling needs to be, it needs to meet the natural health product regulations, and you need to have an licensed Canadian importer if the product is manufactured outside of Canada. There's 3 types of applications you can go with for your products, the NPN numbers. The first one is Class 1. So Class 1 is the easiest and quickest way to get an NPN number in Canada. That's a single ingredient product. Health Canada has a monograph supporting safety, efficacy, and quality of that ingredient. They have already established all the information that's required on that labeling. And that's the easiest and quickest way, and usually takes 60 days to review, and they're pretty on time with those applications. Then we have Class 2 applications. So those are multi-ingredient products, but those ingredients, all the ingredients have monographs established as well. And your ingredient has to fall within the parameters of that monograph. So this is class 2. It takes about 90 days to register, and it's quite straightforward as long as your product fall within those parameters of those monographs. The most difficult and complicated one is Class 3. So that could be a multi-ingredient product. You could have some monograph ingredients in there, but you will have one ingredient that does not have a Canadian monograph supporting the safety and efficacy of that ingredient. So that means we need to submit supportive evidence, especially for safety for human use, and hopefully there's efficacy data as well. And Health Canada would want to see preferably two clinical randomized controlled trials to support the safety and efficacy of the product if it's outside of if there's no monograph for those ingredients. The estimated review time is about 210 days. It usually takes longer, so you're looking at 250 days most likely as they're behind in reviewing those applications. Next one. Okay, so the label requirements, that's quite a bit as well. Labels have to be in both English and French and have to comply with the NHP labeling requirements. So it needs to include the brand name, the NPN number, dosage form, net amount that's on the front label, and if sterile statement, if it's applicable. You need to list all the medicinal and non-medicinal ingredients, the quantity of the ingredients, and potency per dose. Allergens, if applicable, use of purpose, that means the claims, and risk information. You also have to show on the label the license holder or importer. You need to have a lot number on there, expiry date, not best by, storage conditions, and if you have a multi-ingredient product that has a lot of risk information, you might have to actually consider peel back labeling, as there could be quite a bit of information, just to be aware. So now, in order to be able to import your product, the site that manufactures your product needs to be added to a Canadian site license. So that means under Health Canada regulations, companies that manufacture, package, label, or import NHPs must hold a valid product and site licenses to legally manufacture, package, label, or import NHPs to Canada. So that means they have to comply with good manufacturing practices, GMPs, on that site. And part of that site licensing includes finished product testing and stability programs that is not usually required, let's say in a US manufacturing site, but we need to establish those things. Foreign manufacturers, they do have an options to apply for foreign site reference number with Health Canada, so you can do your site can do it themselves to apply for FSRN number. That means you submit your GMP documents to Health Canada, and they give you the number. And once you're ready to annex that site, let's say to our site license, it makes the process much easier. We don't need to submit as much documents once you have an FSR number. But that's something to consider. And you need to have an importer of record, and that person is responsible for ensuring product quality and regulatory compliance. What do we have next? Okay, the step-by-step. Okay, so this is a little overview. What should be happening as you're preparing to come into the Canadian market. So you need to have the NPN number and label. So the step one would be assessment. You're looking into what product you want to bring in, the strategy, marketing, gathering the documents. Once everything is put together, we can application can be submitted to Health Canada. They will take their time to review. You will do your label review, make sure everything is in place, license is received, and you can launch your product. At the same time, you need to have the site license documents in order as well. Pretty much the same steps. You assess the strategy, you gather your required documents for the submission. Submission is submitted. Health Canada reviews the site license documents, which takes usually about 5 to 9 months. You got to make sure your testing and certificate of analysis are in place, since finished product testing is required in Canada. So this is quite an important step. You will receive your license and ready to launch. So you need to have the NPN, compliant label, and site licensing. These are the 3 main points that you need to be able to sell in Canada. Now, cosmetics. So cosmetics in Canada, they're any product that are used to cleanse, improve, or alter the appearance of the skin, hair, teeth, or complexion, including deodorants and perfumes. Health Canada requires that manufacturers and importers must notify Health Canada within 10 days of first selling a cosmetic in Canada. So it's less strict, but you do need to notify within 10 days of first selling. And you have to submit a cosmetic notification form. The information that's required on that CNF form is brand name, product brand, the name and the address of the notifier, manufacturing importing details. A new requirement is label contact information, what type of a product it is, if it's a leave-in or rinse-on, the area of the application, function in the form, is it a cream or gel or powder, and full lists and concentration of the ingredients. So this table here just shows this is new now with Health Canada requires starting this year. You need to have a notifier. So this can be a manufacturer, importer, or authorized representative. So this is a person who submits the form to Health Canada and serves as the main contact with Health Canada. There has to be a manufacturer. So this can be a Canadian company producing or selling cosmetic under its own name or trademark, and they have to ensure the product formulation and quality meets the regulatory standards. Importer. So it's a company or an individual bringing cosmetics into Canada for sale, and their importer is responsible for compliance of those imported products. Also, it's required to have a third-party processor on. So this is a company that formulates or manufactures on behalf of the manufacturer importer. So they handle the production and processing under contracts. This looks a little bit kind of weird, I know, because so third-party processor is the foreign manufacturer, and the manufacturer in Canada it could be like a third-party person as well. Okay, next slide. For the labeling requirements, so again, the labels need to be bilingual, English and French. They need to have the net quantity on the product. The ingredients must be listed in the INCI system, the International Nomenclature of Cosmetic Ingredients. That's what Health Canada requires. Labels can only have cosmetic claims only, and they must meet the bilingual and regulatory requirements. So in a contact information, this is the label contact. There has to be a contact available for the consumer to call and ask any questions or concerns they might have. This person has to be able to like respond in a timely manner, both in French and in English. And just to reiterate the responsibilities, the companies must comply with the Food and Drugs Act and meet the Health Canada safety and labeling rules. So the manufacturer and importer, they are to ensure the cosmetic safety, proper formulation, and compliance with all regulatory requirements. They must maintain accurate records and ensure ingredients are permitted to use for use. The individual, so the notifier again, this is the individual submitting the cosmetic notification form. They can be the manufacturer, importer, or an authorized representative in Canada. Acts as a primary contact for Health Canada regarding the notification. So Health Canada doesn't have to go find somebody across the world, so they want to have a Canadian contact. So it can be tricky sometimes to see the difference between what is an NHP and what is a cosmetic. So it all depends on the product's purpose and intended use. So when in doubt, have to review the claims and ingredients and the formulation. That's how Health Canada determines and classifies the products. So the main distinction is in claims. So Health Canada, if it's a health or therapeutic claim, it requires an NPN. Anything that's like aesthetic and cleansing, soothing, it's a cosmetic and requires an CNF. So there's some examples to give you, it's just borderline kind of examples. So toothpaste, for example, toothpaste with fluoride. Fluoride is considered a medicinal ingredient and it's an NHP. Regular toothpaste, cosmetic. Sunscreen is an NHP. If you have a moisturizer with the SPF factors in it, it's considered an NHP. But if you have a regular moisturizer or a perfume, it's a cosmetic. Hope that makes sense. And I guess, Andrew, your turn.
All right, thanks very much, Kathy. So let's jump into our last category that we're going to talk about today, which is foods. It's probably the biggest category out there. So, you know, what's considered a food? So this is regulated by CFIA. This is the Canadian Food Inspection Agency, and so they conduct you know, random inspections, and they ensure import compliance is being adhered to. Health Canada is responsible for nutrition standards and food safety. So, you know, the labels that you see on products, nutrition facts tables and whatnot, they're really responsible for that. As is CFIA, so it's kind of a shared responsibility. But CFIA actually has more jurisdiction, more power than Health Canada does in terms of recalls and stop sales and whatnot. The CBSA is the border agency. That's the Canada Border Service Agency, and they work in tandem with CFIA and Health Canada, ensuring that foods that are coming in are safe and they meet all the requirements. You know, the SFCR license holder, bilingual labeling, you know, a compliant food label. So there's two key legislations. One is the well, they're essentially the same, one of the same, I guess you could say, the Safe Food for Canadians Act that came into effect in 2019, and then the Safe Food for Canadian Regulations, and so that's basically a subset of the act. So the compliance requirements, all foods sold or imported into Canada must meet the Safe Food for Canadian regulation standards. Importers must hold a valid SFCR license, and so you know, just take a step back. That SFCR license, there are several activities under which you can obtain that license. That's manufacturing, packaging, labeling, importing, and exporting. So someone who's actually shipping out products from Canada to other countries needs to have that export license. And essentially, there's kind of two pathways. Essentially, for importers, exporters, they need to have a preventive control plan. And if you're a manufacturer, packager, labeler, really you need to step it up and have a HACCP plan. So, all right. So as I was talking about in the last slide, export license in Canada, that's required. Is what is the food safety plan that you need to have in place. And so that importer, with that food safety plan, there's basically traceability documents. There's hazard analysis that needs to be conducted. You need to, keep records of testing that's done, C of A's, and whatnot. So because they can be audited at any time by the CFIA. Often these manufacturers of foods, they'll have a HACCP plan at minimum. They may have a GFSI standard too. They may be certified GFSI. GFSI is a global food safety initiative. There are different schemes under the GFSI, such as the popular ones are SQF. I'm sure you've heard of. BRC is another one. FSSC, which is an ISO standard. There are several types of programs, and you can find those listed online. And a lot of the big retailers in Canada these days actually require that you have GFSI standards that you're following, that manufacturer is GFSI certified. It just gives them that assurance that there's a routine audit that's being done and that they're adhering to these strict food safety plan requirements. And of course, in terms of documentation, your labels have to be bilingual. Whether you have a certification such as the GFSI in terms of the manufacturer, and all these documents, really, it's important that SFCR importer have that well in advance, and making sure that you have that and you give that to your logistics provider before shipping it to the Canadian border. Because if things are missing, CBSA is going to hold your product. You're going to be paying a daily fine, and probably you're going to pay a fee also daily to your broker for it being held at the border. And it's because if you didn't plan it out properly, it's expensive to have it held up at the border. So it's really important that before it gets on a boat or on a plane or any mode of transportation that's coming to Canada, make sure everything is lined up really well before shipping. All right, so key labeling and food safety rules. So number one, bilingual in Canada. Both English and French are both official languages in Canada. They are treated the same. And what I mean by treated the same is that the font size has to be the same. English, whatever font size, your French should not be smaller. That can get you in trouble, and particularly in the province of Quebec. You need to follow all the standards, your ingredients, how they're listed in terms of quantity, in terms of other ingredients, your nutrition facts table that has to be there. If it's a supplemented food, you need to have a supplemented foods facts table, SFFT. Of course, allergens, huge. That's the highest risk. If you miss an allergen, it is pretty much an automatic recall. They'll announce it publicly to all news outlets and whatnot. So allergens, you got to make sure all the allergens that are applicable to your product are listed on your food label. And then there's net weight and other details as well. There's basically 12 allergens. The popular ones are milk, peanuts, eggs, wheat. Sulfites are another one. Just really important that's on your label. The front of package symbol. Now this is coming into effect January 1st in terms of the enforcement by CFIA. This is kind of the final phase. The first phase was basically this transition, educating the public about it that's coming, and educating stakeholders, companies that this will apply to. So these are foods that are high in sodium, sugar, and fat, or fat. They will have this kind of square box and a little magnifying glass as well. It's in black and white, different shapes and sizes based on the dimensions of your packaging. Certain foods are exempt. For example, spices or butter or whatnot. Obviously, if you have like salt, you don't have to say high in sodium. It's common knowledge. So yeah, this has already been rolling out. We've been seeing a lot of it on store shelves already, and yeah, January 1st is that cutoff date. I mean, CFIA will start enforcing this. They'll be going probably to at the store level, store shelves, checking, confirming that they are. They will probably be pretty, I would think, quote unquote, soft in terms of they will notify that brand or that importer or exporter or whatnot, and they'll say, hey, this product apply. They're supposed to have that on their label. The FOP symbol, please let us know when you're going to transition this package out that doesn't have it and have the new package, and then we will follow up with you to make sure that it's there. The other thing also that you have to think about, that this could become a proxy as well, is that if you don't have that symbol and then they give you a warning, they're going to probably be policing you more closely for everything else. Right? So that means your packaging, making sure it's compliant, it's bilingual, who's your SFCR importer. They will start digging deeper, and that could happen either randomly at just kind of like a pseudo audit, or they may do it at the border every time it gets shipped in because you've been flagged. So it's really, and that ends up you having to spend time now managing this and answering questions back and forth, right? So it's really important that you do this upstream, you're fully compliant, so that you don't have to deal with the one-off warning and then the subsequent checks and questioning and whatnot that may happen every shipment that comes into the country. So there's something that's optional. This is not really a regulatory requirement. It's more of a marketing tool that companies use. Certifications. GFSI is really more on the activity part of things that won't be really on your label. Typically it isn't, but some companies do put SQF or BRC on their label. You would have to get permission, obviously, from that certifier if you're able to do that. But there's other things too, like organic. Organic is actually a regulation in Canada where in order for you to say certified organic, the product has to be 95% organic of all the ingredients. There are variations of the word organic, like you could say ingredients with product with organic ingredients. So there are variations of it, but if you're going to say strictly certified organic, you have to follow that rule, and you'd have to have a certification like USDA, or there are other organic certifiers out there. And then there's others too that may be applicable to your business, such as halal or kosher. There are organizations that offer those services, and again, that's not a regulatory requirement. It is really a marketing tool that you can use. So steps to keep in mind before shipping to kind of to Canada. This is really important. Is check CFIA's AIRS database for your product requirements. There's also a program now called CARM that's come into effect. In May, that they really ramped up the enforcement of that. And so, if you're working with a logistics provider, they should be working with you on CARM to make sure their information is in CARM. Who the SFCR import agent is, their information has to be in the system as well. And again, make sure that you have all this documentation, your labels are fully compliant, they've been vetted. I would strongly encourage you to, if you've never done that before, work with a consultant like us who can review your label, translate it. Now, when I say translation as well, that French translation, it's not Google Translate, right? It's not Parisian French. It is Quebecois French. It's a different dialect. There are little nuances. It may not get you in trouble if you have that French, but the buyer in Quebec knows, they can read it, and they know when it is Parisian or Google French. They know it's not the same dialect, right? And that could hamper the buyer from actually buying your product. That consumer might go, you know what, this is not proper French, and just not buy it. So really important to have that Quebecois French, the Canadian French, on your packaging. Have all your C of A's ready. That has to be provided to that SFCR importer in Canada, and they may ask for samples. That's how we work. is we ask for C of A's, we ask for samples, conduct a physical evaluation, as well as review all the testing that you've done on the product, make sure that it's in specification. And like I said, you'd have to, if it's manufactured outside of Canada, you have to partner with an SFCR licensed Canadian importer, import agent, basically. A broker, typically, like for example, in our business, we are not a broker at all. We are not a logistics provider. So if you need that, you'd have to partner with them. But we do fulfill those SFCR obligations that you would need. And then, that certification, that's really voluntary. Again, that GFSI certification to, make sure that your manufacturer has, is following a good, robust HACCP plan. And, pretty much all of the food, drug, mass accounts in Canada. And so when I say food, drug, mass, these are companies that I'm sure you've heard of: Costco, Walmart, Metro, Loblaws, Sobeys. Those are big, retailers in Canada, right? They are big stores, big box stores, as they call them. So most of those big box stores do require a GFSI certification. Some will allow for a kind of an interim certification, and they'll let that be in place for a year, but then within that year, they're expecting a GFSI certification of some sort. And of course, that dialogue with that importer is really important, making sure you have all those documents that they need, C of A, samples, etc., before you actually ship that out. And that's our presentation. And so, I would love to open it up to you guys for questions that you might have.
Awesome. Thank you, Andrew, and thank you, Kari. Just one admin stuff. Andrew, if you can share your slides with us so that we can share with the audience. So this is something that came up. So everyone who's listening, everyone who is listening to this recording, I'll also follow up to the emails with the recording of this presentation as well. On to the questions. I see Kashubai, assalamu alaikum. You raised your hand.
Walaikum salam. How are you, everyone?
Doing very well. Thank you for joining. And off to you for the question.
Okay, I got a quick question on one of the, I think it's more likely under NHP. Most likely Katie could answer, I guess. I think you mentioned the claims on when it comes to the natural health products.
Mm-hmm.
So we got a product here we mostly import. It's a psyllium husk. It's a natural product, it's not modified or anything.
Mm-hmm.
But sometimes it comes up with a claim or different sort of claims on it. Sometimes it says it's good for your, let's say, for example, for your gut health.
Yes.
So do you think we have to have a backup or a documentation to sort of, cover those claims, or is it actually something we should not be worried about?
So psyllium husk, I'm pretty sure it has a monograph. So if you license it as class 1, you have to use the claims that it's on that monograph. So if you want it, even if you have an ingredient that could be considered class 1, and if you want different kind of claims, then you have to apply it as a class 3 and support the claims that are class 3 claims. But health, and you will see on the market people making all sorts of claims. It's not exactly the wording, but Health Canada is kind of policing now, and they will look to see that you're, and even in your advertising website, that you're following what's on your license. So if it's a class 1, your label claim has to be one of the claims as per the monograph. Does that make sense?
Right. Well, sort of. I got another product here. I can give an example. Like this is the psyllium husk itself is actually a natural. It's not modified or anything, right?
Mm-hmm.
So I'll give you another example. We have a Dettol liquid, for example. It says it kills all germs or whatever. Like it has a claim on it too, right?
Yeah.
So I think that in that case, wouldn't that be is actually a totally different scenario when it comes to a natural product as compared to a totally different liquid?
It would be an actual product then. If it makes therapeutic claims, it will be a natural product.
Right. Okay.
It'll also depend
Um,
on the active ingredient, just to
Yeah.
add to Caddy, like it depends what the active ingredient is in the product. For example, hand sanitizers, alcohol, kills bacteria and germs and whatnot. That is a natural health product, right? Or whether it's ethanol, whether it's propanol. However, if it has like benzalkonium chloride, BZK, and you're making those same claims, that is now a drug, right? So it's dependent on the claims you're making. The ingredients are considered under the natural health product category. And also keep in mind, if there is a monograph for a natural health product, and if you're making a claim that's not in that monograph, that ingredient's in the monograph, but your claim's not in the monograph, that pushes your product into a different class. So
Yeah,
instead of class 1, it goes into a class 3. And now your timeline to get your license goes from, Health Canada's timeline has been 60 days, non-binding. It goes to over 300. It's 210 is what they've stated online, or as their target. They're not hitting that target. It's taking 300, 400 days, right? So, so that's where, the strategy that we sometimes advise is, hey, if it's a class 1 product, go with that claim, get your license quick, 60 days, then post license, submit an amendment to your license to add that different claim. You can start selling your product with that initial claim, right? Consumers can do their own research online. You just can't say that other claim yet until that gets approved by Health Canada, right? So sometimes, time is of the essence. You don't want to necessarily wait a year to go to market in Canada, but you might get there sooner with a certain claim that positions your product in a certain class, and then figure out the rest later on. So.
Okay, good. Thank you, Andrew.
Sure.
Thank you, Andrew. I think Joya Green Exports had their hand raised up second.
All right, go ahead. I think you're on mute.
We can
Hello,
hear you now. Yeah.
Ji, Assalamu alaikum.
Welcome, Salam.
Actually, my question is, I'm an exporter from Pakistan, and I'm interested to exporting our cosmetic products to the Canadian market. Is there any company or someone who can handle the necessary paperwork and obtain the required permissions for selling our products from Canada? Is there anyone who can help out for the paperwork from our side? My second question is about our food products. We are also exporting the dried food products, and we would like to utilize the same services for the exporting these products. Additionally, we are also interested in exporting the fresh foods like mangoes and the kinnus from Pakistan to Canada for the Canadian market. We are just looking for the someone, either is a company or someone individual that can handle our paperwork, necessary documents, and the permissions from our side.
Yeah, so our company, Quality Smart Solutions, can help with some of that paperwork. So, but paperwork is a really broad term. So to narrow that down, where we can help is on the regulatory aspect of your cosmetics. So making sure your labels are compliant, notifying Health Canada. We can act as your Canadian agent, which is a newer regulation that came into effect in March of this year. So we can do that. In terms of the rest, in terms of logistics and if there's any tariffs and whatnot, that part you probably want to work with a broker, with a logistics broker who does that. But we can definitely take care of your regulatory aspects. On the food side, similarly, in terms of your labeling, we can help there. Now, when it comes to acting as the SFCR import agent, we do have, like, we've actually limited what categories that we can act as that agent. And so fresh foods, fresh fruits, vegetables, seafood, meats are considered high risk foods, and so we actually don't offer the service for those high risk foods, but everything else in terms of packaged foods, bottled foods, dry foods, those are categories that we can definitely support you with. And so, yeah, that's where. Now, just want to also clarify, we are not a distributor, we are not a reseller or a buyer. We act as, a regulatory agent. Regulatory services is really our bread and butter.
Thank you. One question in the chat before I go to the raised hands from Yusra. So, Andrew and Kari, question is, if the daily intake quantity mentioned on psyllium husk is more than 5 grams, is it considered food or medicine?
Well, that's where we would have to look at the NHP, the Natural Health Product Monograph, determine. But I mean,
So
think about. Yeah, go ahead, Kay.
I think it's up to 30 grams. So you can, the Health Canada monograph levels, you can go from, the minimum for the claims is 2.5 and all the way up to 30 grams.
Now, and further to that, also, I believe psyllium husk is one of those ingredients where you can position it as a food as well. However, you cannot make health claims then, right? So there's a trade-off. It's really ultimately, what's more important to you? Do you want claims? The timing that's involved in this, right? Natural health product, you gotta get the NPN, right? That's going to take 60 some odd days. Non-binding, meaning it could take longer than 60 days. Then there's our time. If you were to say use us to prepare that NPN, then you got to also get set up on an import license. Say you're working with Quality Import Solutions. That'll probably take more than 60 days. It's been taking anywhere from 4 or 5 months to 9 months. It's all over the place. And so you can make health claims, but you're not going to get to market quickly. You don't make health claims, there's no license, you get you'll get onto market quicker. And I mean, getting set up with an importer like us, the import agent under the SFCR, far faster, because we don't have to go through Health Canada to get approval of the foreign site, right? So those are just kind of things you have to think about on a business development strategy standpoint. You could always go to market as a food initially, then maybe in parallel you can get the NPN, and then at some point in the future you can say, oh, you know what, I want to start using this health claims. I'm going to switch over, and I've got set up with Quality Import as the importer of record as well for the NHP side. Great, I want to now switch it. I want to put the NPN in it. I want to make strong claims so that I can get a bigger, awareness and maybe more buyers out there, right? Or you could even sell it 2 ways. That's an option too. You could sell as a food, no health claims. Maybe in certain markets, like in Canada, certain grocery stores say, hey, we don't want NHPs. We just want foods. We have a food section. We want to put your psyllium husk there. You put it there, no NPN. But then maybe you're going into some health food store, right? Some big health food store. They want the psyllium husk with the NPN. You have that, you can sell it to them, right? So you have 2 things in your hand that you could position a product like that. Now, just keep in mind, however, so like not every product can be that way. Ashwagandha, for example, NHP is the only way that you can go still today, right? Omega-3 fatty acids, that's fish oil, right? In a capsule, NHP. But some of these are kind of in between. There are some products that meet the natural health product food interface.
And keep in mind too, if you do it as an NHP, you have to do finished product testing for every lot, and it's quite extensive. And there's certain food claims, let's say fiber claims, you might be able to make. So it really depends what kind of claims you want to make. If a certain amount of fiber in a product, you can say for foods like a source of fiber. So there's ways about it, but NHPs are definitely more commitment required.
Yeah.
Awesome. Thank you. Next we have Sultan.
Thank you for the presentation. It was very insightful. Thanks for that. My question is now about, I think you mentioned that you guys don't deal with fresh foods, so be it fish or lentils or rice, etc. Would that be correct? And what about dried fruit? Would you be? Can you assist with that or not?
Yeah, so lentils, if they're dried lentils, obviously rice is typically dried, sold dried, and yeah, dried fruits, absolutely, we're fine with that. It's like we basically conduct a hazard analysis, and the hazards that are for us outside of our risk tolerance, I guess you could say, are those that are basically wet products, right? So fresh fruits and seafood and meats. Also, with the seafood and meat products, you have to get there's like a permit that you have to get. And CFIA will be auditing you almost every shipment that comes into the country, right? It is highly, highly regulated because it's a high risk, right? There's just more risk when it comes to pathogens. So just kind of keep that in mind too when you're shipping meats and vegetables. But more so meats and seafood than vegetables into the country. There is another permit that you have to get. You obviously have to partner with an SFCR importer as well, who's willing to do that. There are some distributors that kind of that's their focus, and they have they have the risk tolerance to do that. But yeah, some of your items could fall under that low risk, and we would be happy to assist as your SFCR.
Right, and just a question about that. If it's actually the shipments for the meat and the fish would be audited each time or checked, or is it just the other shipments are risk as well, just because of the import of those items? What do you think about that?
Yeah, I would say there's pretty much every shipment that comes in for your seafoods will get checked at the border. The fresh fruits and vegetables, there's a higher frequency, but not necessarily every shipment will get checked. But just keep in mind, if there is a deviation or if there's an out of specification on those fresh fruits or vegetables, you will then probably get checked every shipment thereafter. It just becomes you're flagged at the border, right? So just keep that in mind.
Thank you, Andrew. Next, we have Amir. Amir, sorry.
Yeah, hello. Hi, this is Amir. I'm actually in the food supplements business. I'm already so I'm based in Pakistan for now. I was in Canada for 4 years. I'm working with Web Naturals and natural practice in Pakistan already. But I'm already we have a product which is supplements, and we are manufacturing them in Pakistan. It's a food supplement in the gummies form, and we've got like around 42 SKUs. We're now thinking of exporting it to other countries. I'm currently working on documentation with Dubai and launching it in UAE. But also on my radar is Canada and USA. So for Canada, my question is that if we don't have any claims on the label, is it still an NP and a Health Canada product? Will it still require an NP? And if it's got the ashwagandhas and the shilajits and your magnesiums and everything?
So yeah, I don't know, Caddy, if you want to answer that one, or
Depends on the ingredients. It really does in ingredients and quantities. And it claims, of course, as well. So if you make any claims that are, NHP claims, it's an NHP. And if you have ingredients that are considered NHP ingredients in there, like vitamins, minerals, added on, it becomes an NHP.
Even without the claim?
Yeah.
So, and for
there's certain supplemented foods, right? There's certain supplemented foods you can add certain vitamins in it.
Not that. So it's a pure supplement. It's a pure vitamin and supplements product.
That's an NHP.
Okay. And the second question is that even if we get an importer there to import the product, so my objective is to import them and list them on Amazon and sell it online. That's about it. So there's no physical distribution or anything of that sort. So even if there is an importer involved, like your company, which is Quality Imports or whatever, so would I still need to have a company there to be able to work with Amazon and get their funds transferred to my account?
I think,
So no, you don't have to set up a company here because we work with companies all around the world and they don't have presence in Canada. When it comes to Amazon, that's a discussion you'd have to have with them. I can introduce you to someone at Amazon because we're actually an Amazon SPN, a supplier provider network. We're one of their preferred regulatory partners. So, so yeah, that's a discussion you need to have with them in terms of funding, like how they'll transfer funds and whatnot. You would have to obviously set up your account on Amazon.ca, do your product listing, your images. Keep in mind, Amazon, like they're very strict now. Like your product won't go live until you have the NPN, right? They will see it. Their bots become really good, and they can detect how this product requires an NPN. Sometimes they make mistakes, and sometimes they misclassify products, and then people come to us and say, "Oh, can you fix this? That we just got kicked off of Amazon for no reason. We're a moisturizer, and the Amazon thinks we're a natural health product." But yeah, you have to follow due process, and you have to obtain that NPN. And also keep in mind, the natural health product, you are required. So this is, sometimes people think, oh, I can get a natural health product, but I don't want to make any claim. When you get a natural health product license, an NPN, you're required to make at least one health claim, and that'll be part of your license. That when you get that, right, it might be a very low risk claim like antioxidant or maintenance of good health, or it might be something that's maybe higher risk like maintenance of weight, like weight management, or helps in pain due to osteoarthritis, helps in macular degeneration, right, with like a lutein or zeaxanthin. So it really varies the spectrum of the type of claims that you can make with natural health products. But regardless, once you have the NPN, you have to have at least one health claim on your packaging.
And from what I understood from your presentation, sorry, just last question, is that so if I start the process now, let's say I have everything, I've got the product, that's about it. I'm going for the labels and for all the conformity and everything with Health Canada and so on and so forth. And obviously the product is not, the manufacturing is not happening within Canada, so it has to be the site registration and everything. So are we looking at a timeline of around 12 months, 1 year, roughly?
Yep, absolutely. That we tell everybody, like it might be sooner. Like, I mean, the NPN can vary from 60 days to over 300 days, depends on the ingredients, what class it falls into, whatnot. And then what we recommend everybody is do it in parallel as you're getting the NPN. Get set up with the importer too, right? Because that can take you it can be as little as 3 months. It can be as long as like 10, 11 months. It's really all over the place, right? There's a big standard deviation there on the average time that it takes to get set up with an import agent. So, yeah, budget worst case, I'd say, yeah, about a year. Okay, and you do take care of the import agent part as well. Yeah, Quality Import Solutions, our sister company, has held that license now for just over 10 years. We have dozens and dozens of vendors that we work with to act as that import agent around the world. Everywhere.
Perfect. I'll connect with you directly then offline, and then we can take the discussion forward. Thank you so much.
Okay, perfect. Thanks, Amr.
Thank you, Andrew. Thank you, Amr. Any other questions?
Last chance.
Altamash Bhai. Oh, you're on mute.
I think the questions are done. So I just wanted to thank you. It was really a very fantastic session. And I think the participants showed that. So thank you so much, Andrew and Katie. And we hope to have you again, right? On the second part of the series.
For sure. Yeah. We've got lots of coverage.
Thank you so much.
We do. So we're happy to be part of it again. So thanks again, Zohaib and Altamash, for arranging this. And reach out if you've got questions. We're here to serve you.
No, you are the experts for us. We'll definitely reach out. I hope more people reach out to you directly from after today.
Excellent.
Awesome.
Just last question. So these contact us details, do I reach out to you here on the info@qualitysmartsolutions.com?
Yeah, that email comes directly to me. So yeah, you can send an email there, and then we can take it from there.
Okay, thank you.
Awesome. Thank you so much. Thank you, everyone. Again, Andrew, Kadi, thank you, Alessandra. Thank you for your help behind the scenes. I hope everyone found great content and great insight here. I will be sharing the slides later today, and please visit parktrade.ca to view our webinar recordings as well. Thank you and have a good one. Love
Thank you.
Thank you so much.